The
Bayang magiliw, penas na silanganan, alog ng puso, sa dibdib mo'y buhay. Lupang hinirang, duyan ka ng magiting, sa manlulupi, di ka pasisiil. Sa dagat at bundok, sa simoy at sa langit ng bughaw, may dilagang tula at awit sa paglayang may namahal. Ang kislap ng watawat mo'y tagumpay na nag-iinit. Ang bituin na tarong niya kailang pambay di magdidilim. Lupa ng araw ng ating pagsinta, buhay ng isa piling mo. Ang niligaya na pang may mag-api, ang mamatay ng dahil sa'yo.
Building a resilient workforce does not only happen after graduation. Rather, it starts in building a strong foundation during the undergraduate years. Let us hear from the OIC President of Holy Angel University, Mr. Leopoldo Jaime N. Valdez, on how he supports and invests in the School of Nursing and Allied Medical Sciences. His message will be delivered by the chairperson of the Nursing Department, Mr. Noriel P. Calaguas.
Good morning. Thank you, Dr. Marquez. On behalf of our Holy Angel University OIC and President, Mr. Leopoldo Valdez, let me kindly extend our greatest and warmest welcome to everyone joining us across the globe. As part of the technical team, we see that it's a well-attended webinar. And Mr. Leopoldo Valdez currently is not available because of the celebration of Jose Abad Santos Day here in Pampanga, the first Chief Justice who is a Kapampangan, and the university through its Center for Kapampangan Studies plays an active role in making sure that history remains to be well documented and appreciated to this day. Holy Angel University continues to invest in its nursing and allied medical science programs by ensuring that adequate and qualified nursing faculty are recruited into the university to ensure that quality instruction, research, and extension are carried out by the department. Recently, the university has also invested 14 million pesos into securing the necessary equipment to upgrade the nursing arts laboratories to meet the demands of a highly complex and constantly evolving healthcare system. It is the hope of the university that through these investments, we continue to produce nurses who are not only adequate caregivers, but also nurses who would actually lead substantial change both in nursing practice and in nursing policy. So we would like to thank the Filipino Nursing Diaspora Network in the person of its president, Dr. Violeta Lopez, the Philippine Society of SRH Nurses in the person of their president, Mr. Eric Santos, for partnering with Holy Angel University School of Nursing and Allied Medical Sciences. We do look forward to continuous engagement with both organizations as we continue to invest not only in nursing education, but nursing in the Philippines in general. Thank you very much. And as we say in the university, Laos Deo Semper.
Thank you very much, Sir Leo and Sir Noy. Now the President and CEO of FAAN, also a guest lecturer at the Graduate School of SNAMS at HAU, Dr. Violeta Lopez, shall deliver the statement of purpose.
Good day to all the participants
on this third Filipino Nursing Diaspora Day. This day will not be possible without the support of Holy Angel School of Nursing and Allied Medical Sciences, as well as the Philippine Society of HSR Nursing Incorporated. As this day has been initiated by the Filipino Nursing Diaspora Network, let me tell you briefly what this network is about. FIND Network was established in 2018 in Sydney, spearheaded by Jerome Babate, who I know that you already have acquaintances with. FIND Network is a registered company with the Australian Securities and Investment Commission. And the network is a professional organization of Filipino nurses who live and work outside the Philippines. And the network is dedicated to harness the strengths and capabilities among the Filipino nurses and foster camaraderie among them wherever they are in the world. As such, the FIND Network has many affiliations, not only in the Philippines, but also internationally, such as the United States, Canada, Middle East, Asia, Europe, Australia, and New Zealand. This year's celebration of the International Nurses Day on the 12th of May and this Filipino Nursing Diaspora Day today come with an important call to action to invest in nursing. The report in April 2020 from the WHO State of the World's Affairs Nursing and in partnership with the International Council of Nurses addressed the important gaps in nursing workforce and prioritize areas for investment in nursing education, jobs, and leadership to strengthen nursing around the world. According to Dr. Tedros, the World Health Organization Director General, this report is a stark reminder of the unique role nurses play and a wake-up call to ensure that nurses get the support they need to keep the world healthy. The theme of this Diaspora Day is investing in nursing, building a resilient nursing workforce. It is an opportune time to address the workforce issues of the current healthcare organization, and we are grateful to have Dr. Nelson Tuazon as our keynote speaker today. The novel COVID-19 pandemic has led many unexpected changes, not only in nurses' daily lives, but also in the way healthcare facilities function. Organizations were forced into rapid and radical transformations, which has shifted how healthcare professionals begin to think about how to transform healthcare to meet the demands of the current and future pandemic. Nurses has been on the front line of international efforts to tackle the pandemic. They are the most recognized face and more resilient pillars in the modern day heroes in today's pandemic. Many jurisdictions have planned and have transitioned to post-COVID recovery. The healthcare sector itself is forever preparing for longer-term transformation, and all aspects of care delivery models will be transformed, especially in how to invest and retain the nursing workforce that we have today. Reports show that the world will be short of 18 million healthcare workers by 2030. Additionally, 9 million nurses and midwives will be required to achieve the universal healthcare before the end of the decade. The healthcare system has so far demonstrated its resilience and adaptability throughout the pandemic. Now, The complex challenges faced by healthcare organizations will require holistic, forward-looking, and flexible leadership, and how well their individual plans reconcile with the challenges. The World Health Chief Nurse, Elizabeth Iro, said, "A transformation is happening that had given rise to an unprecedented and long overdue recognition of the contribution and value of nurses and midwives that had allowed the profession an important worldwide platform. However, returning nurses in the workforce remain a problem, and strategies to build the resilience is critical more than ever. How are we going to invest in nursing? What are some of the strategies that we could implement? What are some of the challenges in investing in nursing to secure its future? This day will be a time to listen to our guest speakers and panelists, as well as to reflect on each of us of what we can make as a contribution to our nursing profession. On behalf of the directors and the advisory board members of the Filipino Nursing Diaspora Network, I would like to thank our guest speaker, Dr. Tuazon, and the 4 panel speakers for their contribution to this Diaspora Day. I would also like to extend my deepest appreciation for the Holy Angel University School of Nursing and Allied Medical Sciences, as well as the Philippine Society of SRH Nurses Incorporated, for being the collaborating partners of FIND Network, who have organized, published, and supported this day. Thank you to all nurses, clinicians, and academic participants, and I hope that you will all learn from the presentations and revitalize your energies to continue contributing to global health and continuing to be inspiration to other nurses here in the Philippines and also abroad. Thank you very much.
Thank you very much, Dr. Violeta Lopez. Our resource speaker has over 40 years of experience in nursing practice, academe, administration, and executive leadership. He is a fellow of the American College of Healthcare Executives, the National Academies of Practice, and the American Academy of Nursing. He holds board certifications in nursing executive practice, healthcare quality, patient safety, and patient experience. He serves as Texas Organization for Nursing Leadership District 8 Director and member of the nominating committee of the American Organization for Nursing Leadership. He is also a member of the Nominations and Elections Committee of the American Nurses Association and is a member of the ANA General Assembly. He is an adjunct faculty at the UT Health School of Nursing, DePaul University, and Excelsior College. He is a graduate of Angeles University Foundation, Philippines, BSN in 1981, MA in Education in 1985. He completed his Doctor of Business Administration from North Central University in 2016 and his Doctor of Nursing Practice from Grand Canyon University in 2018. He is currently the Vice President and Associate Chief Nursing Officer at University Health in San Antonio, Texas. To hear about how investing in nursing contributes to building a resilient nursing workforce, let us all welcome our resource speaker, Dr. Nelson Tuazon. Dr. Tuazon.
Thank you.
And then swap the
Okay.
display, sir.
Can you see it?
Could you kindly swap the display? Yeah, you have 2 screens. There we go. Thank you
There
very
you go.
much.
Okay. Well, thank you very much. If only that were easy to navigate technology nowadays. I really am very humbled to be here today. The introduction of our president of the diaspora summarizes the tenets of what investing in nursing and how building a resilient nursing workforce means to us. So I want to thank Jerome Babate and Noriel for helping me in preparation for this day. And on behalf of the over 150 nurses in the United States and the 4 million nurses in the US, 4% of which are Filipinos. And I'm really interested in hearing more from Byron, from Francis, from Floro and Maristela, my colleagues who will give us perspective on a global stage about the nursing diaspora. There's about 2 million, depending on what statistics we read, there's about 2 million overseas foreign workers. So Filipinos truly are present globally. And so it is with pride that I present to you the topic that I've been asked to present, and that is investing in nursing, building a resilient nursing workforce. So the objectives that were given to us are, first is to examine resilience and the implications on health and nursing. And I will propose an integrated framework upon which we will review this. And as been mentioned, we will analyze the recommendations of the World Health Organization vis-a-vis investing in nursing and why this is critical at this point. And we will evaluate the propositions of the future of nursing, which is the second edition. This is now 2020-2030, and I'll give you a background of the first report of the IOM in 2010. So as a background, more than 59% of the healthcare workforce is nurses or are nurses. So we compose of the largest healthcare occupational group. And in 2018, which is just about 4 years ago, 5.9 nurses were needed globally. Unfortunately, 5.3 million of those are from low and lower income countries. So we're having issues in the United States, but when I hear that 5.3 of the 5.9 million actually are needed in other countries, it even saddens us. And it truly is that we need to address this critical issue in nursing. And by 2030, we have to produce 8% more of nurses just to get caught up with the demand. COVID, which affected all of us globally, not only in healthcare, but life as we knew it, impacted all aspects of healthcare and nursing. And I really congratulate the diaspora for putting up a program on resilience, because it is key to the future of nursing workforce. And it will require an integrated, comprehensive, and multi-sectoral approach. So you might have heard that we had a great, massive resignation in the United States. As a result of COVID in 2021 alone, 4.3 million Americans quit their jobs. So not only in healthcare, but in all aspects of the workforce. So 4.3 million. So as you can imagine, the stoppage that we have experienced, I'm sure it's not only in the United States, but globally. When we hear about the supplies and the lack thereof, particularly in healthcare, it really put us all in danger. And when you convert that to nurses, the turnover rate in the United States is teetering about 13 to 14%. But in 2019, it was close to 17% of turnover. And in 2020, almost 19% of the nurses left their jobs. And when surveyed in 2021, 22% of nurses indicated that they intend to leave their jobs. So you can imagine the major impact of that in healthcare. So by 2022, this year, it was anticipated that we would have needed 1 million nurses. And with the nurses leaving the profession, it even complicated the situation with our supply. And in 2030, which is about 8 years from now, even if we made up the difference for the enrollment and the nurses that get into the workforce, there is an estimated another 500,000 nurses that will be needed in the United States. So the staggering numbers are truly worrisome. On the other hand, there's no room for nursing students. Look at the numbers that were turned away. Just in 2020 alone, more than 80,000 students were not accepted into nursing programs. And these are qualified applicants. This is not because they did not qualify. We could not take them in our nursing programs because we did not have clinical sites. There's not enough space for them to go. We have a faculty shortage, and the resources available were not enough to meet the demand. And when I say resources, these are faculty as well. So if we have nurses intending to go for their master's degrees or doctorate degrees, they could not go to school. So therefore, we're missing those resources as well. So let me introduce the concept of VUCA. And this was introduced in 1987 by Bennis and Nanas. Actually, it started in the military. The background of VUCA indicated that the environment is filled with volatility, uncertainty, complexity, and ambiguity. And I don't know about you, but that's how the last 2 years felt. And this was conceived in late 80s, and yet we felt it very strongly in the last 2 years. But there is hope. Johansson proposes that we can convert VUCA from being volatile to creating a vision. And I truly commend the diaspora for having a vision of having an international program such as this with close to 1,000 people tonight, and converting or transforming uncertainty to understanding and complexity that we face, not only in healthcare, but in our lives in general, to establish some clarity in the way we see things and in the way we do things. And instead of facing ambiguity, we have to learn to be agile, more fluid, more flexible. So it's still the same VUCA, but the vision, the understanding, clarity, and agility will make the difference. So this is where I wanted to offer a conceptual framework. And I want to disclose that what I'm offering tonight are opinions. They're not based on any scientific research that I have done, but in preparation for the presentation tonight, I wanted to prepare and present a cogent way of presenting how do we address resilience, how do we promote resiliency, and how do we improve our workforce. So I found 4 potential ways of looking into resilience. The first one is from the Institute of Healthcare Improvement, the IHI. And in their website, there is what they call a CAIR, C-A-I-R, and it stands for Checklist for Assessing Institutional Resilience. And I examined the checklist, and essentially it focuses on safety. It addresses the leadership role in making sure that the healthcare environment is safe, that the workers are safe, and most critically, patients are safe. So this tool is focused on patient safety. The Prevention Institute also proposes an acronym THRIVE, which stands for Tools for Health and Resilience in Vulnerable Environments. I like this as well because it focuses on the community. It's a larger scale. It's not focused on the individual or a small organization. And it is policy and program direction focused. So I feel that the Thrive is probably a good alternative to analyzing resilience. And then there's also the Blister Callus model of psychological resiliency. And being a Filipino, I think that we live by Blister Callus model. This is the repeated gradual stress, and we recover. So the stresses of life that we have when we think life is difficult. Filipinos, I grew up from a family of 8. So as you can imagine, my father and mother were merchants. They were selling things from town to town. We did not have a house. We were essentially moving from towns to towns. And so I know that growing up with a family of 8, it was really living in poverty. And so I understand difficult life. So for us that migrated to the United States, we have always felt that the US has always given us the opportunity to improve our lot. And so the Blister Callus model proposes that the more that we face stress and the more we resolve or we repeatedly adapt to the stress, we form a callus. So at some point, if you could imagine a guitarist or a weightlifter, the callus that they have on their hands tell us how resilient they have been. But I don't propose that we have to suffer that much in nursing just so we can prove that we are resilient. So I turned to the literature and I found Morse et al.'s Resilience Framework for Nursing and Healthcare. This one is a little bit more individual centered. It's applicable to patients across all settings. So when I looked at this 4, this is what I propose to all of us. I'm a very visual person. So Morse proposes that the linear adjustment that we have beginning with adversity, because life is full of adversity. And we learn how to deal with adversity. Before the pandemic, we already knew what challenges nursing had. So in the United States, we were talking about short staffing, the same things that we were talking about, not having enough resources for students, for schools, and not having enough applicants. That's why the United States, when it comes to shortages, it resorts to foreign graduates. So we do foreign recruitment. And I'm a product of that. In the early 80s, I was fortunate that I was one of those that were recruited to go to the United States. And it has been a blessing. I cannot tell you how happy we are because we work hard. So that is the pre-resilient stage that we had. We already knew how difficult life is. So when we went to the United States, we knew how to protect ourselves, to compensate and challenge. That is the next step. So whatever adversity happens, because of our pre-resilient state, we were able to achieve the blue box, which is equanimity. Simply said, this is equilibrium. So if we are able to recognize and accept and cope the issue, and that is we protect ourselves, we're able to supplement, replace, and support. Therefore, we compensate so that we can adapt. And then we accept and overcome whatever life might give us and take those as challenges, we achieve equanimity. And the circle goes with recovery, readjustment, and recalibration. So to me, the way we look at the nursing shortage nowadays as a result of the pandemic and other forces, this would be a good framework upon which we can look at the current situation. So let me go through my slides really quick because I want to be able to have questions. I'm showing you the shark and the ice cream. And so what do the shark and the ice cream have to do with what we're talking about today? The shark and the ice cream talks about a phenomenon that has been shown in literature, that the rate of shark attacks is parallel, direct relationship or correlation with ice cream sales. So the more shark attacks, the more ice cream sales. Or you can say it the other way, the more ice cream sales, the more shark attacks. So somebody would say, make assumptions, say, well, maybe there's something in the ice cream that is making us attractive to the sharks. Or maybe just because we're eating too much ice cream, we cannot swim that fast because maybe we have gained weight. So people try to make an association between the sales of ice cream and the number of shark attacks. And sometimes we do that in healthcare. Sometimes two things happen and we create an association. We think, oh, because this happens, therefore this happens. The reality is, if you can imagine, those of you who are thinking now, well, there is if you map them out, if you plot them out in a statistical formula, in fact, there is almost a perfect correlation that the sales of ice cream increases and therefore the number of shark attacks also increases. But guess what? It only happens because it's summer. In summer, we eat more ice cream, and in summer, we go to the beach. So the two things may look like they're correlated, but they're not. So what message does that give us as we look at the workforce? So the assumptions that we have in healthcare and nursing, why people leave their jobs, why people go to the US, why people don't go to the US. So the framing of the question begins with, how do we adopt? What are the things that we can take in nursing as we see it right now? What are the things that we can apply and they will be effective because we will just adopt them? What are the things that we can adapt? Maybe they're not quite perfect, but if we implement them with some modification, we'll be able to be successful. But I think the most critical point is we need to abandon the assumptions that don't work. For example, the assumptions that we make about generations. So I just found out recently that there is now the generation Alpha, and they're not quite at work yet. So we're not dealing with them in the workplace, but eventually the generation Alpha will be the ones we'll be dealing with. No longer the millennials, no longer the generation Z. And most managers that I have are generation X. And those of us in, I would call senior leadership, are baby boomers. So we will be retiring in the next couple of years. So we need to understand the global issues that are taking place right now. This was written in 2018, but might as well have been written yesterday, because these are the issues that nurses face, the emerging infectious diseases. You know, we used to worry about, and we still do, cancer, diabetes, the chronic diseases that we have. But we're more resilient with those because we can adapt because they're more chronic. But when pandemic hits like COVID, it took us by surprise. And it's said that although the Filipinos only make up 4% of all the nurses in the US, 40% of those that died of COVID in the US were Filipinos. And talking about assumptions, some of the assumptions that we have is that, well, Filipinos are usually the ones who work in ICU, in the ER, in the high risk areas. And there's also the assumption that Filipinos don't say no a lot. So if they were asked to work an extra shift, they were asked to come in, they were asked to go to the COVID unit, we will say yes, because that's the assumption that we have. And that is, as Filipinos, we're hardworking and we want to always help. And of course, you open the newspapers or what's the news, you hear about human trafficking. And as rich as the United States is and other countries, maternal newborn health. And that's why I'm glad that the Society for Reproductive Health is very involved in this Diaspora conference today. And of course, health inequities are prevalent. If it even is discussed nowadays, it's dominating the discussion about health. And of course, the maldistribution of healthcare workers. So as I've said, this was written in 2018, but we can feel the essence of this. So in 2010, and I'll make it really quick because the focus that we have is the one on 2020. But I want to give you a background of the first report of the Institute of Medicine, which is now the NASEM, the National Academies of Science and Engineering and Medicine. They put out a report in 2010 called Future of Nursing. And the four assumptions that they had, the four messages, is one, training. We have to educate more nurses and allow them to practice in their fullest level. Then nurses should achieve higher levels of education, and I'll show you a few graphs in a minute. Nurses should become full partners with physicians and other professionals in redesigning healthcare. And effective workforce planning has been proposed in 2010. So that's already 12 years ago. So these were the 10 findings and recommendations that the first report in 2010 put forth. The scope of practice, increasing BSN, and we were successful in that. We, in fact, increased the number of BSNs in the United States, but not to the point that the Philippines is purely BSN schools. So look at the irony of this, Philippines being a developing country and the United States being a developed country, and the Philippines having more BSNs than the US. And if we have time, I have my assumptions about that. Transition to practice. Doctoral degrees, if you have heard, we have now Doctor of Nursing Practice, and I'm one of those nurses that took advantage of that degree. There is a focus on interpersonal and lifelong learning, workforce diversity, interprofessional collaboration and leadership, redesign payment, diverse audience, and workforce data. So they sound very familiar, don't they? So look at what happened with the DNP when it started, and this is less than a decade and a half ago, the skyrocketing of enrollment in DNP. And then as a consequence, though, we needed also PhD nurses so that they can do research. But the way I look at it, whether it's a PhD, a DNP, an EDD, a DNS, I would say go for your doctorate. You know, I always say this to my leaders when they hesitate about going back to school. I said, you can be 35 in 5 years if they're 30 now. You'll be 35 in 5 years with or without a doctorate. So it's your choice. So have we made progress? Look at, in 1924, the first doctorate program was offered at Teachers College, and then a PhD in 1934. Sounds like a long time ago, but this is still our century. And in the 70s, which is only 50 years ago, the DNS, DNSC, and DSNs were proposed. And in 1979, the Doctor of Nursing. And finally, in late 1999, they offered the Doctor of Nursing practice at the University of Tennessee Health Science Center. The American Association of Colleges of Nursing was bold enough to say, we wanted a DNP to be the entry practice for advanced practice nurses. We have not achieved that in 2015, and that is 7 years ago. Now, the National Organization of Nurse Practitioner Faculties are now proposing that the DNP level be the entry level for nurses in 2025. But look at that, what nursing has essentially had done, I would say, a disservice to us. The pharmacy programs in the United States are now all doctor of pharmacy, PharmDs. So if you graduate, you are a doctor of pharmacy. Physical therapy in the United States, if you graduate, you are now a DPT. You're a doctor of physical therapy. Nursing, we still have associate's degrees, and we're still talking about even BSN as an entry level. So in a way, we have come a long way, but in other ways, we have not. So fast forward 2020, 2 years ago, the Future of Nursing was reconvened. This time, the focus is on healthcare disparities. And the background of this, if you have been following the news in the United States, the event with Mr. Floyd and other events that had led to the focus on health disparities and inequity. Actually, the report was late. It was supposed to be out by 2020, but it didn't come out until late 2021. So these are the 4 messages. If you can recall the 4 messages from the 210, they're related, not quite the same. So the first one is permanently remove nurse practice barriers. And I'm going to talk about the advanced practice nurses in the United States. And I can tell you briefly, during the COVID, we lifted the barriers. Many of the nurse practitioners were able to practice without a supervision or collaboration with the physician. They were given full practice. So the argument is, if they can do it during COVID, why not now post-COVID? So there's still a debate on that. And I can tell you, when you are competing with the resources of the American Medical Association and the American Trial Association of America versus the ANA, you just cannot compare the resources that those 2 lobbying groups have. The second message is to value nurses' contribution, prepare nurses to tackle and understand health equity, and to fully support nurses. So I will focus on the underlined words because these are the key charges of the committee. One is to improve health. It's a given in health to improve health, always in the United States, aiming for the effective, efficient, equitable, and accessible care. And here the focus is on building a culture of health and achieving a diverse workforce. So you will hear about diversity, equity, and inclusion in many discussions about health. And that the voice of the individuals, families, and communities be incorporated into the healthcare system, as opposed to having it a medically driven healthcare where the patients are told what to do. We wanted to make sure that our patients, our population, are part of that healthcare system. And nurses to lead the efforts in building a culture. And in essence, nurses being change agents. And wherever we practice, whether in community, in hospital, at home, regardless of the nursing practice area. And so I was listening to your video about the work of the reproductive health nurses. I commend you for the work that you have done. You responded to a bill and essentially created your destiny by creating an organization that meets the needs of the population. And in here, your aim is to eliminate gaps or disparities in healthcare. And I cannot think of a more basic need than reproductive health in the Philippines. And of course, focusing on nurse health, well-being, and resilience. And the last 2 years have taught us that nurses have to be prepared in terms of emergencies. Although with the Philippine Nurses Association, we've been working with missions, helping out the Philippines when there is a calamity, a disaster. So not that we're so used to having typhoons in the Philippines, but the United States were dealing with infectious emergencies and maybe hurricanes and floods, but not to the point of the Philippines being hammered by typhoons. So real quick, these are the recommendations, and I'll focus on the graphic. So if you could look at the graphic just to set a representation of what they mean. So the first recommendation of the future of nursing for 2020-2023 is advancing health equity. So you will hear about the social determinants of health. You will hear about nursing workforce, leadership, nursing education, nurse well-being, and emergency preparedness. So those are all the concepts surrounding a shared agenda in practice, education, regulation, policy, all of the stakeholders. The second one is supporting nurses' advanced health equity. And for those of you who have seen this, congratulations, you know about the Healthy People to 2020. This is the same thing. There are goals set up every decade. So there's the Healthy People 2010. Now we are Healthy People 2020, and pretty soon it'll be 2030. And of course, you know, or you might have heard of the 17 Sustainable Development Goals that talks about hunger, poverty, nutrition, clean water, things of basic nature. So we need to make sure that we educate nurses on those. And then that we promote the health and well-being of nurses. And in the United States, we are fortunate that the American Nurses Association has a nationwide program called Healthy Nurse, Healthy Nation. So it focuses on sleep, exercise, nutrition, healthy habits. So they are promoting that if a nurse is healthy, the nation becomes healthy as well. So that's number 3. And of course, capitalizing on nurses' potential. As I've said, unfortunately, only 28 states have full practice authority for advanced practice nurses. So half of the states still limit the nurse on what they can do. And now we have nurses who have doctorate degrees, but still have limitations in practice. So recommendation number 4 is to remove the practice barriers. And number 5 is paying for nursing care. So you will hear that we are really a cure healthcare as opposed to care healthcare. We're focusing on cure. And I'll share with you a minute or so, Dr. Berwick, if you have time to Google him, he is known for his work with the Institute for Healthcare Improvement. He says that we need to stop looking at hospitals as if they were repair shops. So I'll say that again. Dr. Berwick is proposing, let's look at the paradigm of not looking at hospitals and doctors' clinics as repair shops. Because think about this, when our car is broken, we go to the mechanic, we had it fixed, and probably not never see again until it breaks again. And guess what? That's what we do in healthcare. We don't see our providers. We don't incentivize preventive care. We don't incentivize primary care. We incentivize treatment. So when a patient gets sick, doctors get paid, hospitals get paid. We're essentially a repair shop. Using technology to integrate data. So telehealth, telemedicine is a growing way of delivering care in the United States. Unfortunately, I don't know that we have captured the essence of telehealth, and if we truly are incentivizing individuals to use telemetry, I think we're still focusing on taking patients to the hospital and the emergency rooms. At my facility, we started what we call, things go round and round, as they say. We have now a hospital at home concept. So towards the end of the patient stay in the hospital, if the patient can go home, we have a bed called the hospital at home. So we send the patient at home, and guess who we send to their homes? A nurse. A nurse does the assessment, vital signs, draw blood, so as if the patient never left the hospital, but the patient goes home. And guess what? Anecdotally, we're seeing that patients actually get better fast because they are in their home environment. Strengthening nursing education. You've heard a plea about having more faculty, resources, clinical sites for nurses. We are running out of space. And the pandemic created a chasm when the students were not able to go to clinical sites for rotation because of the pandemic. They were doing a lot of simulations. They were doing a lot of virtual learning. So research has indicated that on their 8th month of work, that is the time they're beginning to work, transitioning into their professional role. So imagine that, preparing a nurse for 4 years or 2 years, however the program is, and then needing to transition them into practice. And the nursing education needs to integrate the following concept: population health, no longer just focusing on cure; environmental health, the effect of climate; trauma-informed care, and we're not talking about physical trauma, the trauma, emotional trauma, the burden of care; health equity; and of course, social justice. 8, as you have heard, the preparing nurses to respond to disasters and emergencies. And as I've said, I think a lot of nurses are known to be resilient. We deal with natural causes of disasters, but I don't know that we were prepared to face COVID. We have had AIDS, we have had Ebola, but not to the extent that the COVID-19 had hit. And finally, the recommendation is about evidence-based and research, that there should be a research agenda. And I know there's a few PhDs in our midst today. So in your research agenda, look at the social determinants of health, look at nurses' health, environmental health, nurses' well-being, and health equity. So these are ripe for research at the moment. So what do we do? Where do we come in? What does the World Health Organization suggest? Again, they have 10 recommendations, and I'll focus on the bolded words. As you've heard, we need at least 5.9 million additional nurses. That's a lot of nurses. The United States only has 4 million nurses. So to have 5.9 million across the globe is tremendous. We need workforce data. We need to understand who's coming into the workforce, why they are leaving, where do they work? Do we have more men or coming into the profession? Are there more second-degree nurses? Number 3 affects us personally, that mobility and migration must be managed and monitored responsibly and ethically. And I will say a few more words later on. That education must include primary health and universal health. And I can tell you the United States is still struggling on even defining what universal health is. And nurses have to be at the leadership and governance level. As we always say, if we don't engage ourselves in boards, or if we are not participating actively, we will not advance our profession. And we should optimize the contributions of nursing. And we need to have a collaboration and coordination between policymakers, employers, and regulators to create decent work. And I've been following some of the news in the Philippines, and I really look forward to hearing from Maristela the current state of the work environment in the Philippines, and from Byron from Bahrain, and Francis from UK, and Floro from Finland. We need to develop an agenda for a gender-sensitive nursing workforce to attract more men into the profession. And because of the limitation in practice, there is a need to modernize regulation of nursing. It's antiquated, it's old, it no longer meets the needs of the current healthcare environment. And the last one, collaboration is key. So we're down to our last few slides. So I will put the recommendations, if there is any interest in ourselves, the Diaspora, the Philippine Nurses Association. There's 3 buckets, and I think Dr. Violeta made this very clear. There are 3 buckets. We need to think about education. We need to think about jobs or the future of workforce, and leadership, how we lead nursing. So under education, we need to make sure that we have funding for nursing education, that we focus on primary care, and that we prevent and manage communicable diseases. On data, we need to have, on workforce, we need to have data on workforce, and we have to look at ethical and responsible monitoring of migration and collaboration on workforce planning. And most critically, as leaders, and there's a lot of leaders, I have to tell you, I feel old when I saw the pictures of my colleagues who will present today. I look forward that one of these days, I get to meet all of you, because nurses have to be in leadership role. In fact, the World Health Organization even suggests that countries consider having a government chief nurse. So think about it. The United States has a surgeon general. Although at one point we had a nurse who was a surgeon general in title. There should be a nurse that leads nursing in the country, according to the World Health Organization, and focusing on healthy work environment and modernizing nursing regulations. So I did a quick environmental scan since I spoke to Noriel the other day. And I want to, if there's anything that I want you to take away from this presentation, if you look at Mary Joy Garcia Diaz's article in the latest February, this is last February in 2022. She wrote about the ethical recruitment of internationally educated nurses, and essentially focuses on the role of the Philippine Nurses Association in collaboration with the Philippine Overseas Labor Office and the Commission on Filipino Overseas. The Philippine Nurses Association and the one in Byron and Francis and Floro might take some ideas about this. We have an orientation program for nurses just before they arrive to the United States, and we give them an orientation program. Right now, it's still virtually giving them an orientation of what's happening in the United States. So look at that, and then the economic value of hospitals. Look at the articles, just Google environmental scan for investment in nursing, and there's a lot. There are hospitals that are providing hotel service types to nurses because they're competing for nurses. The Mayo Clinic investing 100 million in hospital care at home. That's the one I mentioned to you, that we send our patients home on the last couple of days of their stay whenever they can. And there's an article that says why hospitals should invest in nurses. So there's definitely an interest in investing in nursing. So the article about whatever it takes, hospitals get creative in hiring nurses amid a national shortage. These are all great resources. So in conclusion, what do I offer in order to invest in nursing and to promote Ford's resiliency? The first thing we need to do is build. We need to build our leadership, our stewardship, and our management capacities. And I am so glad that I had this opportunity to be with you today, because you are all leaders in your own fields. We have to optimize the return on investment on anything that we do to promote nursing, optimize those, and we will require some policy options here. And then we will have to accelerate and sustain additional investment. So this is how I will graphically represent to you. The biggest wheel is the build. We need to build, we have to rebuild almost, and we need leadership for that. And the big wheel will move the second one to optimize. And that optimization will lead to a better return on investment. And as we return the investment in nursing, we will accelerate and sustain the gains that we had accomplished. And in so doing, it will trigger the wheel again to build. So it's a constant rebuilding of ourselves. And finally, I have not done research on all of this, but I feel that the health equity, we have talked about social determinants of health, but we need to think about the ethical determinants of health. And that's for another diaspora presentation. We also, and I know you and the US right now are in such flux and turbulent times with the politics. And I know that health is affected by politics. So to me, there are political determinants of health as well. And most critically, I would challenge you to read on Donald Berwick, B-E-R-W-I-C-K, of the Institute for Healthcare Improvement. And he wants us to look at the moral determinants of health beyond the social determinants of health. So these are what I call the social determinants on health on steroids. He's talking about homelessness, hunger, immigration, reforms, criminal justice reforms, and so on and so forth. So to me, health equity will remain at the core. And so this is what I presented to you earlier. So how do we put all of this together? So the same concept that I presented, adopting from Moore's. The new adversity could be a next pandemic, could be the socio-political factors, could be the election, could be economy, could be the war in Ukraine, whatever the factors might be. But the pre-resilience level that we have will determine the way we protect, we compensate, and challenge ourselves. And the future of nursing 2020, 2030 are good recommendations for us to compensate for what we have lost in nursing. And the World Health Organization Global Strategy on Workforce will help us recover, readjust, and recalibrate. The warning, though, is if the social determinants of health and inequities in healthcare remain to be unresolved, then we'll go back to adversity. So with that, I call to action. So what do we do as we re-emerge from this global pandemic? How can we as the diaspora can do to rebuild a resilient workforce? I hope you had one or two ideas. What are the strategies, including the barriers and facilitators that can cultivate and sustain resilience? Whether you follow the Callus Blister, whether you follow the CARE or the Thrive or the one of Moore's, figure out what strategies we can do as an organization. And then most critically is what are the actions that nurses can take in all our settings so that we can strengthen the nursing workforce, take away the silos from where we are. And I really look forward to having nurses from the Middle East, from UK, from the Philippines, from the US, in Europe, in other places, to coalesce and create another conference like this with Diaspora. And then what can organized nursing groups and governments help to protect and promote the safety and well-being of nurses so that we can rebuild our nursing workforce? So you received a lot of data today. You have heard about information. I hope you had knowledge to collect all of that information, in a cohesive way. And the intelligence will be how to connect all of the knowledge that you have gained today and from our next group of speakers. And most important, what wisdom have we gained from this? So this is my challenge to you. The wisdom that I pose is what I shall do on Monday. Today's a weekend. First thing on Monday, what about the social determinants of health? What about resiliency? What about workforce planning? Can we do in our own way so that we can make a difference in our profession? Thank you for the opportunity. And I look forward to seeing and hearing the rest of the speakers. Noriel, I give it back to you.
All right. Thank you very much, Dr. Tuazon, for sharing recommendations on how we can better invest in nursing, therefore building a resilient workforce. We will be having our Q&A after listening to our 4 panelists. Again, you may post your questions as early as now in the Q&A feature of the platform. So hearing his insightful presentation, we shall now be listening to equally renowned Filipino nurse leaders sharing their perspective and experience on the topic. They will be echoing the collective voices of nurses around the globe. Our first panelist is a graduate of Western Mindanao State University in 2004 with a degree of Bachelor of Science in Nursing. He holds a professional diploma in healthcare quality and accreditation from the American University of Ras Al Khaimah and a certified key performance indicator professional. He also holds a Master of Arts in Nursing, major in Nursing Administration from the University of the Philippines Open University. He is currently working as the Assistant Director of Nursing for Quality and Patient Safety, Research and Evidence-Based Practice, Magnet and Informatics at King Hamad University Hospital, and has done numerous work on building capacity of nursing research and informatics, along with improving hospital processes and patient outcomes through his focus on nursing sensitive and hospital indicators as measures of improvement. He is a valuable member of the Accreditation and Quality in King Hamad University Hospital and was instrumental in achieving national accreditation of Tariq Hospital, King Hamad University, and Awali Hospital in Bahrain. Here is a video presentation from Mr. Francis Byron B. Opinion, who is also here with us today.
Our students from Marhaba, greetings from the Kingdom of Bahrain. I'm Francis Byron Opinion. I'm the Assistant Director of Nursing, Head of Nursing Quality, Research and Evidence-Based Practice and Informatics at King Hamad University Hospital in the Kingdom of Bahrain. It is an honor for me to be invited as one of your panelists in the third Filipino Nursing Diaspora, and with our theme, Investing in Nursing, Building a Resilient Nursing Workforce. I'd like to be very spontaneous in discussing basically because most of my content were mostly of my personal experience, and I'd like to share it to all of you. I'd like to share some information that are not really mostly academic, because I believe most of our participants are students from Holy Angel University, College of Nursing and Allied Medical Sciences. I titled my presentation, Nurses That Can Withstand the Storms. Okay, we'll proceed. The objectives of my presentation will be understand the many factors that affect resiliency, understand how an organizational system's processes contributes to nursing resiliency, understand how organizational culture and decisions affects the nurses, discuss the role of nursing leaders in creating a resilient nursing workforce, and discuss the personal opinions, as I've said, about investing in nursing. It's not always about financial resources. Well, we'd like to define what is resilience. Resilience is the ability to face and adapt to challenges, to overcome them. A person with strong resilient skills can handle disappointment because they don't let setbacks keep them from progressing. Like other people, they experience difficulties and stress, but they experience those factors more positively and don't allow them to impede success. Now, what can affect your level of resilience? Can someone tell me, you're resilient, you believe you're resilient, but the level of your resilience may change because of some factors. What can affect your level of resilience? Could be your work environment, workplace culture, institutional processes, standards, guidelines, your coping mechanisms, and your support systems. I'll be discussing that, all of it, as we go along. Well, one is work environment. Practice environment or work environment includes your colleagues, your staffing adequacy, if you're experiencing shortage, human resources, provision of care resources, the consumables, the PPEs, the resources that you use for patient care. Those are care resources that you require to work effectively. Leadership visibility is one thing, and I'll be discussing that further later, and decision making. Well, unfavorable work environment includes lack of recognition, okay, staff inadequacy, hostile physician, nurse, or collegial relationship, lack of autonomy, bullying or threatening environment, blame culture or punitive culture, poor response to nurses' concerns, disharmony, and lack of teamwork. I did a study, it's a 5-year longitudinal study with regards to practice environment scale nursing work index, focusing on these factors that affects how nurses perceives their working environment is healthy for them. In creating a favorable work environment, in my personal experience, I did a study. I started in 2015. A favorable working environment in itself can enhance the coping mechanism of nurses as the support and value system is working. As I've said, one of the key factors that affect your resiliency is your coping mechanism. I did a 4-year longitudinal study conducted in a tertiary hospital in the hospital I work. Understanding nurses' perception of the nursing practice environment, they revealed that the practice environment scale nursing work index mean scores improved significantly over 4 years over time because of the quality improvement initiatives such as registered nurse participation in hospital committees, transformational leadership training, quality link training programs, and staffing based on dependency assessment and skill mixing. As you know, I'm actually highly involved in creating process in the organization. That includes creating a workplace culture. That includes assessing what, for example, what will be the nursing model that will be applied, as I believe that nursing care model is not one size fits all. It depends on, for example, the area where you're working. It was published in 2021 at the Journal of Patient Safety and Quality Improvement. Maybe you can read it further by searching it on Google. Measuring learners' perception on how safe their working environment. It was a 5-year longitudinal study, correct me. A while back, I said 4-year longitudinal, but it's 5 years. Started in 2016 and ended up in 2020, but I'm actually doing it annually because I'm trying to reach magnet recognition program. Okay, so as I've said, it was found out to have an increased perceived favorable practice environment among nurses in the organization in 2020 and first 2 months of 2021. This is during the pandemic. Imagine that. And how did we do it? I'll talk about it later. Now, another thing that I have discussed about is your institutional cultures. It actually, the organizational culture affects nurses' resilience. I'd like to ask, if you committed a mistake, how do your managers or leaders handle such deficiencies or the mistakes? Are they being punitive? Are they blaming? Okay. Or you're blame-free. Your environment is they practice blame-free culture. What does blame-free culture means? Whatever you do, you will not be penalized. Okay. There were some process that you have to undertake during the investigation, but definitely you will not be blamed for such a deficiency. Now, Another uh, safety culture that we're practicing is just and fair, in which it strikes a balance between blame-free and punitive. I believe by the definition itself of just and fair, it actually provides you an opportunity to learn from your mistakes because you will be held accountable for your mistakes. A lot of deficiencies in blame-free environment are taken not really seriously, and the staff doesn't learn. Based on my personal experience, because during the time that we started the organization back in 2011, we believe and they practice a blame-free culture. Although it was just actually 2 years when I tried to introduce just and fair culture, and it requires a lot of communication to stakeholders that include the higher management and to convince them about the significance of changing from blame-free culture to just and fair. Because of the learning opportunities that we can establish for all of our staff. Now, one thing that can actually affect the level of your resilience is your policies, your standards, your procedures, your guidelines, your protocols. Do you adhere to your standards? Or do these policies apply to all and not to only few? Do you observe that? Do you somehow realize that, okay, why am I being told to do this and they can do otherwise? Okay. Does it improve outcome or just mere paper exercise? Others, I believe, because of accreditation, based on experience, because I work in this field, I'm involved in some organizations, other external organizations, to perform consultancy, and I provide them feedback. And I observed this. It's more on paper exercise to show as an evidence compliance, but it doesn't impact the outcome of care because it wasn't adhered to in a manner that it will positively impact the organization. Are these being used to penalize employees? The policies, once you breach a certain policy, are the managers or the leaders use this to penalize you? Okay. Now, how did I say that it can affect your resilience? Now, it depends on the organization and how they select references of their policies and protocols. Is it really evidence-based? Are these standards, are these protocols simplified that the staff are able to practice in harmony, in unison? When you talk about standards, it is applied by one and applied by many. There's no difference in the way you wash your hands. So you have to look into this because somehow it impacts the perception of nurses, of your staff, especially new ones, on the manner of implementing such standards in your organization. Another is your coping mechanism. Now, when you talk about resiliency, there are a lot of skills that you have to establish within yourselves to say that you are having such high level of resiliency. One is you have self-confidence. You are confident, not arrogant. There's a borderline between arrogance and confidence. Well, self-confident means you know where you stand and you're confident about your knowledge and you're able to apply it because you're confident. All right. Patience. Are you patient? Do you have patience? For example, if one of your colleagues tried to insinuate some negative thoughts about you from others, how do you react to those? That's part of resilience. And if, for example, your patient keeps on calling you, bugging you, and you have a lot of things to do because of your usual workarounds, you need to have such kind of character to build a good resilience. Another is optimism. Are you positive? You seem to have a positive outlook in life. Whatever happens in the unit, you think of a better outcome. You think that, yes, it happens. I still learned from it. Whatever happened today, I learned from it and I was able to cope up. That's optimism. That's part of your resilience. Now, another thing is you're flexible. Okay, oh my goodness, one of our colleagues failed to come to work. So what am I going to do? Should I extend my duty or whatnot? Well, it depends. Sometimes you think that you have reasonable time to extend or perhaps help your colleague to your other colleagues in the unit to sustain the number of staffing, then you can. It's about flexibility. For example, your leave hours might affect the others, and you're flexible enough to adjust yourself. That's one character of a resilient person. Another is you're self-aware. You are mindful of your actions. You have mindfulness. Whatever you do about whatever you're doing at work, you are mindful of how it will affect others and your patients. Okay, your decision making skills. Are you decisive, or you have multiple decisions and you can come up with one decision? Well, that is one thing about a resilient person. Another is you're being responsible. If you're given the task, you are making sure that you'll be able to establish an outcome coming from that responsibility. Another thing is you're a team player. You work with the team. You don't work alone. No one is an island. Now, support system. Support system means your environment. Is it very supportive? Once you made a mistake, are the environment available to provide us help, to support, to give us advice, to coach, or to guide us on what to do? Okay. Now, investing to our nurses is not about giving allowances, bonuses, increasing the salaries based on experience. There are nurses that actually stayed in an organization because the organization is so healthy to work with. They are highly engaged. We're talking about engagement later. Invest your time as a nursing leader, as managers, as a team leaders. Invest through giving your time. Invest through capacity building. Capacity building is not just about to increase the number of staff, but to improve their knowledge about and skills about nursing. That would actually improve their resiliency. If they have the skills and knowledge, they will improve their confidence. Okay, they can actually increase their good decision making skills because of that. Now, invest through active listening. Now, I did some activities that improves visibility of nursing leaders. That includes nursing rounds, nursing leadership rounds, wherein you are mostly asking nurses about their what they learned from the day, how did they feel, what are their feedback about work, and any concerns that related to their working environment or their concerns about work itself. It is being communicated during the nursing leadership rounds. Now, you just don't do leadership rounds because just to highlight that you're a nursing leader. No, you need to have the objective. One thing that I have also experienced is that we need to have leaders that are passionate enough and that are highly engaged and passionate to perform things of the concept of leadership in itself. It's something that we can discuss in a different day, in a different forum, because perhaps our students will not be able to cope up because of those concepts that are actually learned through experience. That's why I tried to avoid being so academic with this presentation. investing by manifesting genuine care. If you're a leader and approaching an employee, you don't appear to be, you shouldn't be appearing to be threatening or in authority or dismissive or a snob. I'm not saying snob, but obviously there's no one perhaps. But something that would would not nurse wouldn't even care to approach you is if you have that negativity. The aura is so negative, and there's no aura of support or care. Well, you can see that because if you're working in hospital environment, you can spot different kinds of employees and different kinds of leaders, and you know when to approach, how to approach, who to approach. Thank you so much.
Thank you very much, Mr. Francis Byron B. Abenojar. Our second panelist is a compassionate and inclusive leader with 30 years of experience, and this is comprised of more than 21 years in the UK and mostly in the NHS. He has held senior posts like clinical matron, orthopedic practitioner, clinical nurse specialist, and nurse consultant. He became one of the first Filipino nurse consultants in the UK in 2014 and was recognized by the Philippine Embassy. He was awarded the 2012 Clinical Leaders Network Quality Award for striving for excellence in hip fracture care, becoming the first and only Filipino nurse winner. He is the founding director of the Filipino Nurses Association UK, which won 3 awards at the National BANE Health and Care Awards this year, where he also won the 2021 award for Inclusive and Compassionate Leader, the first and only Filipino nurse to clinch the award. It is an honor to hear from you, Mr. Francis Fernando.
Hi, thank you for that, Precious. Good morning, everyone, and good evening to those who are in the other parts of the world. So you could probably tell it's around 3 o'clock in the morning here, UK time, but I'm very happy and privileged to be here with you today. So I'd just like to take this opportunity to thank Jerome Babate for giving me this opportunity or platform to be able to tell you the resiliency of Filipino nurses in the UK, especially during the pandemic and in the last 2 years. So if I could just share my screen, the presentation itself doesn't talk about investing in nursing, building a resilient nursing workforce, which is the theme of the webinar, but bear with me because there will be some topics and discussions about resiliency and how Filipino nurses in the UK are coping currently with the challenges that some of my colleagues have already mentioned. So the Filipino Nurses Association UK was founded on the 2nd of July 2020 in the midst of the first wave of the pandemic. And as my colleague Precious mentioned, we won the National BAME Health and Care Awards for the Community Initiative of the Year last year. So as you can see, we have our values there at the bottom of the screen: compassion, learning, opportunity, visionary, integrity, empowerment, and respect. The acronym is GLOVIER. We are the first nursing association in the UK to be awarded by the National BAME Health Care Awards. So, heroes and angels. These are some of my colleagues, nurses, health and care workers who died of COVID-19 in the UK. So there were around 82, 84, depending on your source of information. And that is around 8% of the total deaths of health and care workforce in the UK, which is more than doubled the number who died in the Philippines. And we have the highest death rates of any ethnicity in the UK. And the reasons for that will be discussed later in the presentation. These portraits were made by a nurse in Dubai called Nathan, and this is his way of honoring our colleagues who gave their lives in the UK and left their families back in the Philippines. So before the Filipino Nurses Association UK, in April 2020, at the start of the pandemic, I wrote to the UK Parliament for Women's and Equalities Committee. So that's the equivalent of our Philippine Senate and Philippine Congress in the Philippines, to express the concerns of my communities here, Filipino communities in the whole of the UK, not only in England, with regards to the disproportionate impact and high numbers of Filipino nurses and other healthcare workers dying from COVID-19. So my colleague, Dr. Tuazon, mentioned earlier about a chief nurse for each country as a recommendation by the World Health Organization. So we do have one for England, Wales, Scotland, and Northern Ireland. So I also wrote to Ruth Bay, who is our chief nursing officer for England, with the same concerns, and also to the REST National Director. I even led a fundraising campaign with the Balik Bayani Foundation and the RCN Foundation. RCN stands for the Royal College of Nursing, which is the largest nursing union in the world, with nearly 500,000 members nationally. So we managed to raise around £22,000 to help those bereaved families of our colleagues. So there wasn't any Filipino Nurses National Association then. There was PNA UK, but they were inactive, and the officers all resigned for various reasons. So really there was no voice and no representation of Filipino nurses, which make up the largest foreign nurses in the UK, with more than 40,000 of us during that time. But there are hundreds of local Filipino communities scattered all over the UK. So Filipinos felt during the pandemic that we are not seen and heard, especially at national and regional levels. And I'm so lucky because I've also managed to be a member of the Chief Nursing Officer for England's Black and Asian Minority Ethnic Strategic Advisory Group since 2012. So I used that opportunity to influence change. So we've established the association, as I said initially, on the 2nd of July. We have our mission and vision and values, as you can see there. We also came up with our constitution and bylaws. We held a logo making contest, and the winning logo, as you can see, is on the slide there. Initially, we only had 100 members nationally, and those are the like-minded leaders Filipino leaders who excelled in their different fields of nursing across the UK, not only in England. That's why we are Filipino Nurses Association United Kingdom rather than just England. We held different workshops, which I will explain later on in the presentation. We even had an oath-taking with the Philippine Ambassador Lagdameo, and we had participated in the world's largest research on the impact of COVID-19 to the Black Asian minority ethnic population, which was led by Leicester University, and it's called the UK Rich Study. I was also interviewed by BBC Two Newsnight, Channel 4 News here in the UK, and many other broadcasting media and print and social media to raise awareness about the high proportion of Filipino deaths due to COVID-19. And we recently celebrated our first year anniversary in Oxford. And currently we are participating in a COVID-19 public inquiry with 40 other international nursing, midwifery, and other doctors and other BAME groups in the UK. So we are a non-for-profit, a political community interest company. So we are all volunteers. We don't have any funding from the government. We are successful though in applying for some Florence Nightingale Foundation grants, and also from the NHS England and Improvement grants, and some local grants to especially the Government of London. local government of London. So these are just some of the mechanisms or ways I used to raise awareness with regards to the high debts of our excuse me, Filipino colleagues here in the UK. So I've used my social media account to engage in debate and also continue to raise awareness with regards to the high debts of our colleagues. So why are our colleagues disproportionately dying due to COVID-19 here in the UK? Are we not protecting them properly with the right PPE or with the adequate PPE? Are we not doing risk assessments? Do we think that COVID is racist? So as you can see there, one photo there of Henry Tuazon. He was in his 40s, I believe, early 40s when he died and collapsed after his shift. And then we've got a colleague there again, Herminio, who was 63 when he died. These are just some of our collaborators. So we work closely with so many organizations in the UK, including the Filipino International Nursing Associations and Diaspora Network, which is leading this webinar today. There's also the Filipino channel, as you know, channel 2. They have a Filipino channel here, Juan EU Connect, different international nurses and midwives associations too. Okay, so these are just some of the reasons why we encourage our Filipino nurse colleagues here in the UK to join us. So our membership is for free and they will be supported with different professional development. So we mentioned about investing in nursing earlier and building a resilient workforce. So these are just some of the ways that we contribute in ensuring that we build a resilient nursing workforce, specifically Filipino nursing workforce in the UK. So we do mentoring and coaching, and currently there are around 160 Filipino nurses who have received free coaching and mentoring from different health and care leaders in the UK, and 30 of them had promotions, including 2 Filipino nurses who are now deputy chief nurses. So the highest nurses in the UK are 2 Filipino nurses who are already deputy chief nurses, but the highest ranking will be a chief nurse, but we don't have a Filipino chief nurse yet, but hopefully one of them will become a chief nurse soon. So we also provide personal support. So we mentioned about being resilient, specifically pastoral care for new nurses coming into the UK. So we do have meet and greet sessions via Zoom or face-to-face now that COVID restrictions have been lifted, but we also provide support during personal crisis and advising them and posting them to different resources too. There are a lot of bullying, unfortunately, and harassment and inequalities happening in the workplace. So we're also ensuring that we support them through our different regional and national officers. So we are also an award-winning association, and we represent diverse members across the UK in different sectors too. And as I mentioned, we collaborate with those different organizations. So these are just some of the workshops that we offer for free. As you can see, we are offering enhancing leadership skills workshop and even wholeness and wellness, so health and well-being. And we will have our first face-to-face conference, national conference, which will be held in London at the Royal College of Physicians on the 20th of May, which will be 2 weeks from now or less than 2 weeks from now. So we held our ground launch in November 2020, excuse me, and we have guest speakers, including the CNO or the Chief Nursing Officer for England or the Chief Nurse for our country, Ruth May, and His Excellency Ambassador Antonio Lagdamea. So as you can see, we have also participated in the vaccination campaign for COVID-19. And we are also fundraising for the typhoon disaster relief for Odette, for those families who were affected. And we also held a recent spiritual well-being session with different faiths, which was well attended, and that was on the 6th of February. So achievements of Filipino nurses in the UK. So we're talking about ensuring that we are building a robust and resilient workforce and also investing in our nursing workforce. So these are some of the major awards that our members and officers have won recently. This is in 2021, so that was last year, and in 2020. Again, some of the achievements. So we've got 3 officers and members who have been awarded the Order of the British Empire and British Empire Medal for their work during this COVID-19. And we have 3 Florence Nightingale Foundation Leadership Scholars, including yours truly. And I'm one of the only 3 Filipino nurses who have been successful in the UK to be awarded with this scholarship. And there's so many more achievements there. And so I won't go through them in detail. These are just some of our achievements in photos. So you could probably recognize Rose Eclarinal there from Juan EU Connect and also from the Filipino channel here in the UK. So we celebrated quite recently the ethnicity recognition that Filipinos have now with the National Health Service and also with the Nursing and Midwifery Council, because it used to be that Filipinos were not counted in data and statistics. So we are grouped together with other Asians. So we're now part of this ethnicity data collection form. Again, some of the achievements of my colleagues. And quite recently, during the Florence Nightingale Foundation global launch. And this is just me, so I was shortlisted as one of the 10 finalists, only 10 finalists from more than 24,000 applicants in more than 184 countries for the Astra Guardian Global Nursing Award. As you can see, there are 305 from the UK. There are just 2 of us, myself and Professor Julia Downing, but I'm the only one who is Filipino, as you can see, in those 10 finalists. And also I'm the only one from the National Health Service. You probably know May Parsons. So she is the first nurse in the world to administer the COVID-19 vaccine to a patient. So May Parsons is one of our regional officers. So during our collaboration and networking, we also participate in different award ceremonies. So you can see some of our officers here either attending as guests of speakers like May Parsons there, or as nominees or as judges during the Nursing Time Awards last year. We also do some outreach program to ensure that we listen to our members' concerns, specifically with regards to their health and well-being, because a lot of nurses in the UK are burnt out and are mentally exhausted, especially in the last 2 years due to the pressures and challenges of COVID-19. So this is the first outreach program we held in Derby, which is in the middle of England. And again, we went 2 weeks ago to another place in the middle of England, which is in Morecambe Bay. So we are hearing fantastic work by different National Health Service trusts to ensure that the Filipino nurses are valued, empowered, and enabled. So this is our engagement event on an outreach program too, quite recently at the University College London Hospital, which is one of the world's largest and most prestigious teaching hospitals based in London in the UK. So they work closely with the University College of London. I won't go through the historical background, but basically we've been coming to the UK since the 1950s as exchange students, like in the US. So currently there are more than 40 of us, which makes us the largest group of foreign nurses working in the UK, not only in the National Health Service, which is a government hospitals. So these are just some of the data, but there are not data from the Nursing and Midwifery Council. So the number of Filipino nurses will be slightly lower. So as you can see there, there's only 17,000 because they're not counting Filipinos in the ethnicity collection forms yet. So there's around 5.86% of all the nurses in England, not in the whole of the UK, are Filipinos. So we mentioned about career progression earlier. Unfortunately, out of the more than 40,000 Filipino nurses in the UK, there are only 40 of us at senior level. So I'm an associate director of nursing and quality. There are only 3 of us in the whole of the UK out of more than 40,000. 26 of us work in London. So I won't go through this Filipino nurses story, but basically, unfortunately, these stories happen to our newly arrived Filipino nurses here for different reasons. So Filipino Nurses Association UK are supporting all of these Filipino nurses. So these are just some of their stories. And in the UK, we know that racial discrimination exists because we've got all of this evidence, as you can see there, including staff surveys. So survey results for many, many years since 2003 coming from nurses themselves. Some of the testimonies by my colleagues with regards to the support that we provided. So Leonard Liro here has only been in the UK in less than 2 years, and he's now a band 7. So if you become a band 7, you are an equivalent of a head nurse in the Philippines. So because of the support that he's got from us, like the mentorship program and the mentoring, the mentorship program and the interview skills and leadership sessions, he managed to achieve his first band 7 post in less than 2 years being in the UK. So his career, his promotion has been fast-tracked, and more testimonies. So we've recommended to ensure that we engage with 20 of the chief nurses from the Black and Asian minority ethnic communities in the National Health Service to ensure that Filipino nurses are represented at national and regional forums, and also ensuring that we are representative of the numbers of senior nurses in the National Health Service. So I mentioned about coaching and mentoring initiative earlier, and also tailored secondment opportunities and leadership programs like the Aspiring Deputy Director and Director of Nursing Leadership Programs, which at the moment are limited to our white colleagues. There are a few BAME colleagues, but no Filipino nurses yet have managed to, apart from one, managed to be accepted into this program. So I've mentioned about the Florence Nightingale Foundation, and we also would like to ensure that we are represented nationally by being in NHS England, working with NHS England and Improvement. And we have 2 Filipino nurses at the moment working nationally. One is the International Nurses Advisor, and the other one is the Clinical Research Advisor for the Workforce Racial Equality Standard. And we would like to have some cultural awareness and pastoral care program as part of the induction for the newly arrived Filipino nurses in the UK, and also for their colleagues, to ensure that they understand what the cultural Filipinos are, so that we can prevent any conflicts and misunderstanding which can lead to the Filipino nurses being dismissed. So these are the highest ranking Filipino nurses in the UK at the moment. I mentioned about the deputy chief nurses who are nearly chief nurses. So Edmund Tabay is originally from Iloilo, and he's our highest Filipino nurse so far in the UK. He came to the UK in 2021. And those are just some of my colleagues, including myself. I mentioned that I'm one of the only 3 associate directors of nursing and quality, and the other 2 are Oliver Soriano there and Jose Marinas. So I mentioned about the support for one another, caring for each other conference, which will happen on the 20th of May at the Royal Callus position here in London. It's a mental and health well-being conference, and this is the first time we'll be holding such a live conference and face-to-face conference, and so we're very excited for that. So we will be talking about resiliency there too, and ensuring that we are building the future workforce to encouraging people to join our noble profession. We also quite recently held a women empowerment seminar. As you can see, some of my colleagues there as officers, they shared their stories or hear her stories during that webinar. So in summary, we are the largest foreign nurses in the NHS and in the UK. Unfortunately, we also have the highest death rates due to COVID-19. The Filipino Nursing Association is the largest Filipino Nursing Association in the UK. And we are also, according to the World Health Organization, the largest provider of nurses worldwide. But unfortunately, only 37 senior Filipino nurses work in the NHS. I've added the others there who don't work for the NHS but work in other sectors. But we're not short of talent and knowledge because of the awards that we've won and the recognition. And the take-home message is for Filipino nurses who have just arrived here in the UK. So to ensure that they join us and join any trade union, to ensure that they are represented in disciplinary hearings properly, so that they know what the system and processes here, so to prevent them from being dismissed from their work and be sent back to the Philippines. Also engage with local Filipino communities and ensuring that they are registered with the Philippine Embassy in London. So I just want to quickly finish my presentation from a quote from Dr. Jose Rizal, with a quote from Dr. Jose Rizal, who once said that it is a useless life that is not consecrated to a great ideal. It is like a stone wasted on the field without becoming a part of any edifice. And that's the reference list. Thank you very much for listening. And I'm sorry about that scribble there in the middle. I don't know what happened there. Back to you, Precious.
All right, thank you very much, Mr. Francis Fernando. Our third panelist is a qualified registered nurse in Finland, Sweden, Norway, Iceland, and the Philippines. He specialized in infection prevention and control nursing with focus on infection control guidelines for international nursing students. At present, he is a senior lecturer teaching nursing and allied health courses at the School of Health and Social Care and the head of the degree program in international nursing at the Oulu University of Applied Sciences. He is the founding president of the Filipino Nurses Association in the Nordic region, or FINN, and the Society of Filipino Nurses in Finland. Here is a video presentation from Mr. Floro Cubelo.
So I'm going to speak about our university and the location. So where is Oulu actually? And I'm giving you a brief background of the city. So Oulu is located in the Nordic, in the northern Ostrobothnia part of Finland, where the only university hospital is based in the entire northern region. So we have 200,000 people here, and we use Finnish language as our main language at the clinical field and also at the university. And Finland has been named as the happiest country in the world for 5 consecutive years already. So Finns, when they know this, they were all surprised, not because they smile and always and laugh, but the country is a safe and peaceful place to live, and they have a good social support and trusted government system. So we are offering different programs from different fields, and we will open our English program nursing by August. And this is very exciting times for me as the head of the degree program nursing, knowing that it will be very multicultural. And just to tell you, there are 2 Philippine nursing students coming into the group. So I'm very excited and looking forward for the first first group of this program. So this is our campus. There are 3 campuses of the Cubelo University of Applied Sciences, and the campus for the social and healthcare services is located at Ontingangas, which is just at the back of the Cubelo University Hospital and quite close to the city center. So we have about 1,700 students studying at the campus, and the all universities faculties of medicine, biochemistry, and molecular medicine, as well as all university hospital, are located in Kontingangas. And we have good collaborations from the academic university as well as with the Oulu University Hospital, which is our base hospital for our social healthcare services students. And also located in the same building is the vocational college called OSAW in Finnish, and where licensed practical nurses are also studying. And this is located in Kontingangas. So as I mentioned, the Bachelor of Healthcare degree program in nursing will be opening this fall, and we will be receiving 20 students from different parts of the globe of different nationalities. So we have students from America, from Europe, from Asia, and some parts of Latin America. And I heard that there will be one student coming from Brazil, so she's from Latin America. And the Nordic countries are on for the best education, healthcare systems, and democracy, and so on, and very clean and green environment. But nurses have also experienced poor working conditions for the past few years due to critical nursing shortage, and also the call for a salary increase by trade unions has been declined by negotiators. So in Finland, we have a collective bargaining agreement. Employer must follow. So we have had a strike here for a week. And then one doctor politician was about to make a mandatory law asking nurses to go to work to secure the patient safety. So this has resulted an outrage among nurses here in Finland, and nurses threaten the employers for a massive resignation. If salary increase will not push through, then many nurses will actually resign this summer. And this will be a catastrophe for the healthcare system in the country. So nursing resilience during pandemic times in Finland has been challenged extremely. So this has been new, actually this was news published at the website of the International Council of Nurses. So when I actually moved to Finland, I did not know that the scope of the integration problem among internationally educated nurses to become qualified nurses in Finland has been very, very, really challenging. So when I moved 8 years ago, I wasn't aware that there's no such thing as bridging program or top-up program like many English-speaking countries where Filipino nurses migrate, like in the US, Australia, UK, Canada, and New Zealand. So it is very challenging for Filipino nurses to become qualified registered nurses, and in some parts of the Nordic region, for the fact that they need to almost start from the scratch. So there are 2 ways for Filipino nurses to get license, either to apply for a license directly from the licensing authority, which is called Valvira in Finnish, and wait for almost a year for this decision. And upon decision, they have to be instructed to go back to school to compensate for the missing units in comparison to the European Union Directive 55/2013, which is the backbone of the nursing education in Finland. So the other way is to apply for study place at the university, and normally as like with other applicants, so that the head of the degree program can accredit their courses taken from the Philippines and take a few clinical practicums or practical trainings. And how is this related to the topic of nursing resilience? So this leads to dissatisfaction among Filipino internationally educated nurses, which would lead to the skilling phenomenon. So they can't use their skills, what they have gained and learned from the Philippines, and also which will lead to nursing attrition and burnout among our colleagues, and thereby they will not pursue anymore the registered nurse profession in the country. And Finland, having a critical nurse shortage, should not waste their skill. We should not waste skills of these nurses. And I will show you in the next slide why the Philippine Nurses Association in the Nordic region has been a game changer actually in the Nordic society, in the Finnish society in general. So we have made concrete steps and solutions to help our colleagues to ease the process, to help them become registered nurses. So I will show you one concrete solution later. So when Filipino nurses decide to accept their job as nursing assistants or licensed practical nurses of Finland, they actually undergo a lot of challenges and hardships. So before arrival, Filipino nurses Filipino nurses experience recruitment hardships because they're juggling work at the same time studying Finnish language to achieve the minimum level required by the employers. So they have issues with family ties because they couldn't get their family members immediately, and some information prior to departure were also uncertain at the same time as with the contract being signed. So what is alarming is that they also have received inappropriate Finnish language training that do not really answer their particular workplace needs. For example, when the first batch of Filipino nurses recruited to work at university hospitals were deployed to, for example, in operating room theaters and also medical surgical wards, they didn't receive an extensive training to learn medical terminologies when they were in the Philippines. So they have really struggled when they moved to Finland to their specific workplaces. So when they are at the workplace, they experience more hardships and challenges in such a way that their mentors do not really understand their needs during the orientation period. Some say that the competencies for nurses responsible for general care were also unclear because the orientation was done in Finnish language and they did not really understand what was it all about. So when they are at the workplace, they have difficulties communicating with the patient and other colleagues, and they felt discriminated because of their Finnish language skills, although these nurses have years of experience working in the tertiary level of care in the Philippines, such as in operating room theaters and emergency department units and other special units in the Philippines. So I would say that evidence-based integration program for internationally educated nurses is the key to resilience. Otherwise, they have all given up the following week when they have arrived to Finland. So I am actually doing a dissertation studies at the University of Eastern Finland Nursing Science Department on international mobility of the Filipino nurses to the Nordic region. So this is a Delphi study for developing a multidisciplinary integration program model and policies to nurse migration. So my purpose for this is to have a wider studies that be conducted in the Nordic region, so that the results can be proposed to the policy and decision makers, so that there will be changes on the system of the recruitment process, on the education, top-up education program process here in the Nordic society. So in Finland, when you study PhD, you need to publish scientific articles from different journals, and I mean before graduating, and also during defense, you need to do it in public. So how to make the workforce for internationally educated nurses more resilient? So I am suggesting some few tips on how to make it more resilient. So the top-up education program, which we have done a lot of effort in cooperation with the Philippine Nurses Association in the Nordic region. I should say that the top-up education should be encouraged in all universities of applied sciences in the Nordic region. So otherwise, we are wasting the skills of these nurses. What have we done to make this happen in cooperation with FAAN? So we have actually sealed a memorandum of understanding with one local university of applied sciences in Helsinki, in cooperation with Arcala University of Applied Sciences, to give ways to Philippine nurses to get into the nursing workforce by doing a top-up program. So recently, other University of Applied Sciences have duplicated the system, and now most polytechnic universities or UAS want to do the same for all upcoming students with nursing backgrounds. So this is actually a triumph to all of us foreign nurses, and we will continually work hard for our colleagues to the rest of the Nordic countries. And for foreign nurses, especially Asian, the family is really important, very important. So it should be so that the nurses can take their family members, especially children and partners, to immediately go with them on migration. And the spirit of resilience would be doubled or even tripled when they are together with their family members. And the adjustment is much easier. And for the career pathway for Filipino internationally educated nurses and even foreign nurses, it's important that they can advance their career from being a nursing assistant or a licensed practical nurse to being a registered nurse, or even to a higher position, nursing, nurse managers, clinical nurse specialist, an advanced nurse practitioner, or even senior lecturer, someone who is in academia, which is doing right now. So for Philippine nurses, although the main reason usually when moving to Finland is getting better salary and working conditions, they will appreciate more if their salaries would also increase once they have finished their studies as nurses and they can do the work that they have studied. And what is my take for this topic is that the internationally educated nurses or foreign nurses should be taken into policy and decision-making process so that their working condition and career pathway would improve, which will strengthen a better workforce resilience in nursing. So I would encourage the decision makers and politicians to include us and IENs of foreign nurses in making decisions to improve our working condition. So I would be glad to answer your questions through the chat box, or you can personally email me floro.cubelo@oam.fi. And this will be my presentation for this panel discussion.
All right, thank you very much, Mr. Floro Cubelo. Our fourth panelist represents the nurses from the Philippines. She is a graduate of Bachelor of Science in Nursing from the Pamantasan ng Lungsod ng Maynila in 1983. She obtained her Master's of Arts in Nursing under a scholarship grant from the University of Asia and the Pacific in 2004. She's the current national president of the Filipino Nurses United, or FNU, a national labor association of Filipino nurses. She's also one of the conveners of the Solidarity of Health Professionals and Personnel for a unified plan to defeat COVID-19, or SHAPE UP. Here is a video presentation from Ms. Maristela Abenojar, who is also here with us today.
Provided us a very clear perspective of our webinar stream. And my fellow panel of reactors have shared to us the experiences of our colleagues from Bahrain, United Kingdom, and Finland. Allow me to share with you the experiences of our nurses here in the Philippines and their struggle at the midst of COVID-19. There are three main reasons why the state should invest in nursing. First and foremost is the fact that the country's healthcare delivery system will collapse if the government will not ensure that nurses' work conditions and welfare are supported and protected. According to the World Health Organization's 2020 State of the World Nursing, nurses in the Philippines represent 71.2% of the human resources for health. Nurses must be saved so they can save lives. Maldistribution of health facilities and hospitals is a perennial problem, and this is the second reason why the state should invest in nursing. Only 49% of the 42,134 barangays have existing barangay health stations, or BHS. Almost 10% of the 1,493 municipalities in the country are doctorless, and 42% of the total 1,235 PhilHealth accredited hospitals are concentrated in the National Capital Region, in Calabar Zone or Region 4A, and in Region 3. Because of devolution, the working conditions of our nurses at the national level under the Department of Health differs from those in the local government unit and the private sector across the 17 regions. Third reason is that public health system needs to be strengthened in our country. There should be at least one barangay health station in every barangay with at least one public health nurse to provide the basic promotive and preventive care necessary at the grassroots level, together with other members of the health team. COVID-19 pandemic has tremendously hit the largest workforce in the healthcare industry, the nurses. The pandemic actually aggravated the chronic problem of understaffing in nursing, secondary to prevailing low wages, inadequate benefits, inadequate protection, and absence of security of tenure. This resulted to longer work hours, more than 8 hours a day, heavier patient load ratio, which put the nurses' lives in extreme risk. The symptoms of underinvestment in nursing are glaringly obvious. From the 5.024 trillion national budget this year, the Department of Health has been allotted with only 188.3 billion for its operation, including the amount for the purchase of COVID-19 vaccine as booster doses amounting to 48.2 billion. There is no budget allotted for hiring additional nurses or even for increasing their salaries. There is also no budget to ensure benefits and compensation of health workers, and even in improving the problem of inequitable health care. The recently approved Republic Act 11712, last April 27, 2022, or the Health Emergency Allowance, during national health emergencies provides the same amount of benefits in the Department of Health's one COVID allowance or OPA, which is 3,000 for low risk, for medium risk, 7,000 pesos. The said amount is way below what they are used to receive, which was released actually with so much delay. Health workers are in the and regulation of 1712. For exploitation of nurses in their entry salary of salary grade 15 or 35,097 pesos stipulated on 7 has only been implemented 18 years after the passage of the Philippine Nursing Law of 2000. First, contractual nurses remain salary grade 11 or 25,439 pesos a month, even if they have the same job qualifications and the same job description, just like the regular nurses. And the implementation varies according to the income classification and financial capability of the local government unit. That is the stipulation in the 1989 approved Republic Act 6758. On the other hand, nurses in the private sector only gets the Department of Labor's minimum wage for non-agricultural workers, which is 537 a day or 11,800 pesos a month. What complicates it further is the presence of regional wage board. So nurses, for example, working in outside Metro Manila or National Capital Region are receiving less than nurses here in Metro Manila. A nurse residing, for instance, in a Region 5 or Bicol region only receives 310 pesos a day, while a nurse in Bangsamoro Autonomous Region of Muslim Mindanao receives 280 pesos per day. These are the realities that push many nurses to leave their hometown provinces and migrate to the cities. Mass resignation of nurses in the private sector was highlighted last year. They either transferred to the government hospital or migrated to other countries. Nurses are hardworking, diligent, and kind-hearted. But like other workers contributing to the economy of our country, nurses also need to provide for their families, food on the table, education for their children, comfort at home, medicines in times of illness, and many more. Thousands of nurses were hit by the demotion policy of the Department of Budget and Management, Circular Number 2020-4, during the height of COVID last July 17, 2020. This was resolved by the year-long sustained and vigilant lobbying of nurses, which reverted the demotion policy of Department of Budget and Management, wherein a nurse 2 position had one salary grade increase from salary grade 15 to salary grade 16, which is 38,150, and nurses with positions under nurse 3 up to nurse 6 were retained according to their respective salary grade allotted prior to the demotion. Considering the current cost of living, the inflation rate, and the difficulty of motivating our Filipino nurses to remain in the country, there is a need to increase the salary of all nurses across the country, public and private sector. Saving lives is a vital and essential service that is regular and not seasonal. Hence, security of tenure of nurses must be guaranteed. They must be hired as regular workers and not contractual. Contractual workers do not have benefits like paid sick leave, paid vacation leave, no free hospitalization assistance, and other benefits during pandemic. No work, no pay. Even if they got COVID, So during their 14 days quarantine period, they are not paid by the employer. The government must enact a law ending the practice of contractualization among nurses and workers in general. The DOH reported last January 10, 2022, a total of more than 30,000 health workers infected with COVID and 117 deaths, mostly nurses and doctors. Behind these numbers are thousands of families of nurses and health workers affected by the risk endangering the nurses' lives, including mental health problems. Many of them suffered from COVID twice, thrice, or repeatedly got COVID. Who will be the front line to save lives if our nurses themselves became patients? Who will take care of the carers? Nurses negotiated with the concerned government agencies and legislators to immediately investigate the increasing number of health workers vis-a-vis the very slow distribution of personal protective equipment or PPE. Nurses do not deserve to be the sacrificial lambs in this COVID-19 pandemic. Resiliency of nurses has been abused and exploited. Politics have affected necessary health interventions to provide enabling work environment for nurses and other health workers. The call for free testing, efficient contact tracing, free access to COVID vaccination, mass hiring of nurses, adequate personal protective equipment, and timely release of the mandated COVID-19 benefits for frontline health workers until now still remains to be addressed. Sadly, the billions of money we lost from the anomalous formally transactions of DOH and DBM could have been used to save thousands of lives from COVID-19. As of April 18, 2022, the final report of the investigation conducted by the Senate Blue Ribbon Committee is still for signature of concerned senators. The key strategies actually to empowering our nurses are organizing and labor education. Nurses' right to form or join nurses' organization or existing health workers' unions or association must be encouraged and protected at all times. There is significant power in the voice of our nurses together with other health workers to negotiate and assert for their basic labor rights and general welfare. Let us keep that courage and solidarity spirit in our hearts as we face many such challenges in our daily lives. Let us continue supporting each other in coping with hunger, in disasters and calamities, or even in fighting mental anguish or demoralization. We are aware that investing in nursing to build a resilient nursing workforce is not easy and will still be a long struggle. But we fought a good fight. Remember that we nurses are part and parcel of an entire healthcare delivery system. And this entire healthcare delivery system is actually affected by social determinants of health, politics, economics, cultural dynamics, and many more. 2 days from now, we will be voting the next leaders of our country, president, vice president, senators, congressmen and women, and party list representatives, as well as local chief executives. Let us vote for good leaders, someone who empathizes with the people they will serve and whose platform really reflects pro-people stance. Someone with good track record and integrity, and not just empty promises. Someone who listens and truly engages the people in local governance. And someone who encourages, or rather recognizes the intensity of the problem, but is able to give courage, hope, and light. On behalf of the Filipino Nurses United, I would like to thank the co-organizers of this webinar for inviting us to be part of this significant and enlightening sharing. The Filipino Nursing Diaspora Network, the Holy Angel University School of Nursing and Allied Medical Sciences, and the Philippine Society of SRH Nurses Incorporated. Maraming salamat po sa inyo. Fellow nurses, let us be proud, good servants, caring for people's health. Isang makabuluhan at mapagpalang araw po sa ating lahat.
Thank you very much, Ms. Maris and FNU, for being one of the most active organizations in asserting our rights as nurses here in the Philippines. At this juncture, we now open our forum to questions from our audience. Again, please use the Q&A feature. We have the first question here for Dr. Tuazon via PM. As you mentioned earlier, Dr. Tuazon, the expansion of the scope of practice is the first step in addressing the nursing shortage. Can you share how the ANA navigated its talks with the AMA about expanding the role of the nurse, especially in primary care?
Great. Thank you for that very insightful question. I tell you that I don't want to make it sound like it's easy in the United States, as I've said in one of my slides. When we talk about the full practice of a nurse, only 28 states actually allow it. So there's still the medical model that the physicians rule the medical regimen. So what we have done, though, is we have an association, primarily the American Nurses Association, representing the 4 million nurses. But we also have specialty organizations, such as the Association for Nurse Practitioners and the Organization of Nurse Practitioners Faculties. What I would say personally is that as nurses, we still need to socialize our members, that as soon as they join the profession, when they graduate, that they must join their professional association. When you think of 4 million nurses, only about 12% of us are members of our association. When you talk about physicians, and I'm thinking even the lawyers, even during their last school year, they are so socialized to become members of their association that they become powerful in numbers, and their membership dues support their lobbying efforts. So there are promises, though, in the horizon that we have more nurses that are pursuing graduate degrees, and they're completing their doctoral programs as well. And there are senators that are advocating for primary care. As you have mentioned, I think Maristela said it very well. There are political factors that affect our practices as well. I think Jerome and Francis mentioned it too, and say we need to be part of the bigger picture. And who's our colleague from Finland? I really commend him for the work that they do as well. So yes, there is dialogue between the AMA and the ANA, but I tell you, there's more work to do. If I could, though, there is a question from Vanessa about the curriculum. So I had asked if there's somebody from the Philippines that can answer the question better. The question that she has is about revising or restructuring the education program, because most of the students that are going through the courses right now are either virtual or simulation. And as I said in my presentation, our new graduates, they only feel comfortable after 8 months of getting their first jobs. So imagine the transition in practice that's needed. If you're an employer and you are recruiting nurses, you're saying to yourself, you need to be able to support, and we should provide transition and practice programs, provide preceptors, provide the experience so that the nurses can actually do what they were supposed to have done. When they were in school, they were doing a lot of simulation that they may not have the direct practice experience. So as employers, it's our responsibility to make sure that we provide that opportunity for them. One, for patient safety. The second is if we don't onboard the nurses, especially as I mentioned, the Generation Z that we have right now, they want to learn, but they need to feel that they're being supported in the environment. And her follow-up question is, I'm gonna give chance to others to speak after this. She asked if we should continue migration from the Philippines to other countries, understanding that the Philippines itself is probably hurting when we lose our nurses. So I want to hear from Maristela, her point of view about that. We have our point of view here. As I've said, we're needing 1 million nurses in the US ourselves. So, but we don't want to steal from another country who's also suffering just because we have the money to pay for them. But on the other hand, I'm looking at the economic factor. I would have not benefited. My wife is also a nurse. We have 2 girls, children, and one of them is also a nurse now. And I don't know that we would have that opportunity had I not been able to go to the United States. So I'm a little bit biased by that. So I say allow nurses to go as long as there is opportunity as well in the Philippines to fix the issues that you just presented. So I'm going to keep quiet and listen to my colleagues.
Let me open that question to our dearest panelists. In your opinion, what can be improved with the Philippine nursing education system?
Ms. Precious,
Yes, Ms.
can I be allowed to speak?
Sure po.
Okay. First of all, I'd like to give a rejoinder to the first concern raised to Mr. Tuazon. And thank you for seeking our opinion here in the Philippines, sir. We do recognize that there is a need for nurses in other countries because we have been hearing this situation from the news. No? But let me clarify that we do not agree that there is shortage of nurses in the Philippines. In fact, according to the record of the Professional Regulations Commission, as of December 2021, we have already reached less than 1 million registered or licensed nurses. No? These are the nurses who passed the nursing licensure examination. Although records of the Department of Health, which we feel have not included the number of nurses in the LGUs, state that we have 100,000, about 100,000 nurses in the public and private sector here in the country. And the Philippine Overseas Employment Administration mentioned also last year that about 350,000 of our Filipino nurses are in other parts of the world. So granting that we have about 450,000 employed here and abroad, we still have about 450,000 more. We can conclude that some of these are nurses working in non-nursing jobs. For example, in business processing offices or call centers, or nurses in the military or in the police sector, or in other commercial establishments. We also have underemployed nurses, especially for the private duty nurses. And we have also unemployed nurses, which is about 200,000 nurses or more. So there's really a lot of nurses in the country. But why do we suffer from chronic understaffing in many health facilities here? It's because the salaries and benefits being offered to them, just like what I mentioned in my slides presentation, are actually not enticing. It's not even worth it. It's actually giving less dignity to our profession. This is the reason why many of our colleagues here in the country are not keen on applying in jobs available here. No? Secondly, because of the contractual scheme, it's only about a 6 months term. After that, they have to renew it or most of the time it's not being renewed. So this is the reason why we cannot blame some of our nurses who are really pushed to the wall and thought of migrating to other countries. So our stand for the Filipino Nurses United is to respect the decision of our individual nurses, because it's a question of survival. It's a question of supporting their families out of hunger. So we are not encouraging nurses to leave the country. I would like to make that clear. But in situation wherein our Filipino nurses are already processing their applications going abroad, who are we to prevent them? Because even in our 1987 Constitution, it's very clear. They have the right to choose where they want to work, and they have the right to travel. The challenge really is for the government to improve the situation here. And this is the reason why the Filipino Nurses United have always been assertive and vigilant. And we have been sitting, we are so visible in many instances, negotiating with our government officials in the executive and legislative branch, telling them the urgency of really increasing the salaries and benefits of our nurses here, so that we can motivate more of our nurses to stay in the country. And of course, to improve our nursing curricula in such a way that we show to them the actual health situation in the country, so that they will be prepared when they graduate. Of course, there are some foreign policies being accepted by the government, like the ASEAN Mutual Recognition Agreement, and so on and so forth. But the Filipino Nurses United still is firm in its stand, saying that before we entertain foreign policies, we have to first and foremost ensure that the work environment for our nurses here is really something that will support them to practice their profession and see their significant contribution in the healthcare delivery system. So that's how we feel it is significant that, according to Dr. Tuazon in his presentation, we must be increasingly involved in leadership and governance. Because if we really want to have significant change in the nursing profession, especially here in the country, then we have to start making our voice recognized, making our voice firm, and really speaking up the voice of the little nurses that we have here in the country, so that they will be respected. And even if they go out of the country, they will also be recognized and respected. And I think all the nursing organizations in countries like in Finland, in UK, and in Bahrain, who are really organizing our colleagues there, and I hope they will also encourage them to be aware of their economic rights, their democratic rights in their destination country, so that they will be also not capacity building is okay for the nursing profession, but let's not miss the opportunity of really educating them also on their democratic and economic rights, so they will not be treated inhumanely in some parts of the world. That's it. Thank you very much.
Very much, Ms. Naris. Very well said. As I read the comments here in our chat box, nag-agree po silang lahat, and they commend you for your answer. Maraming salamat po. We have Sir Byron, Francis' opinion. Yes, sir.
Hi, good morning. It's 7 a.m. here. I was actually awake since 2 a.m. in the morning. It's an honor to share this opportunity to discuss and to open conversations with regards to nursing resiliency. Actually, what highlighted a while back with regards to the message of Dr. Nelson, Dr. Tuazon, is about nurses being able to participate and proactively getting themselves involved in this, in which I did. I believe Ms. Maristela Abenojar was with me, together with Jerome Babate and some other nursing leaders, in which we spearheaded some discussions with regards to creating solutions for nursing salaries, in which in the Philippines, it's a problem of culture. We normalize the profession as a secondary profession in healthcare. And up until today, you remember one of the senators said that the nurses in the Philippines are room nurses. It should provide you an information that there's a problem with the culture. It is even in the Congress, in the Senate, they considered nurses as a room nurse. It should provide you. I didn't hate the senator. Actually, it gave us a trigger that, hey, let's talk about this. Let's professionalize nurses. And there's Nursing Act until now it's pending. And it talks about the advancement of nurses. What we did, I was questioned even because I don't represent a nursing organization at the time. I was just an executive advisor of the Philippine Nursing Association here in Bahrain. However, I was told that I am highlighting myself, in which it is definitely not, because there's no people. There's only few like Miss Abenojar and some other leaders who's actually getting themselves involved in helping nurses. I remember when I started the conversation, I think Mr. Jerome was there, and I was actually interviewed by a local news organization talking about it. And imagine nurses and midwives receiving 5,000 pesos per month. And there's a lot of factors, multifactorial. This is not just about the government. You need to look into the grassroots. We need to involve conversations with regards to our professionalizing nurses. What are we in the society? Imagine up until today, you are just ducklings when physicians are doing rounds, up until today. And we normalize it. We even accepted the fact that we are secondary professionals. Now, again, regarding the salary of nurses, Ms. Abenojar, we personally met a congressman in the House of Representatives, and it involves, at this point, that's why I think Dr. Tuazon mentioned that we need to have a representation in the Philippine government, like a chief of nursing, unlike other countries in which they have. Imagine we lobbied. We even identified one who can work with us with our objective, and gladly it did. I have to be fair. I have to be fair with this government. At least we were able to increase the salary of nurses, although there are deficiencies with the bill that was passed, in which we were able to help other people in the Congress to help and resolve it. And I think Mr. Maristela was very instrumental, and I have to name the Senate, the congressman. It was Mike Defensor who fixed it and lobbied and personally spoke to President Duterte to fix that deficiency in the Nursing Act. As I've said, I have to repeat myself. There's a multifactorial in each institutions, like agencies, private sector governments. There are also governance in those institutions that we need to look into. Are they prepared? Are they experienced to govern a specific institution? Again, private nurses. We talk about private nurses. How can we enforce a 30,000 salary if the revenues earned by a private hospital is not enough to purchase resources and to provide care? I mean, we have to be very open, yes, in conversation, but we need to be realistic. And there's a lot of things to work on in this. This is not just about a single person fighting for it, like the FNU. We have nursing leaders. I started talking to nursing leaders. We even created a chat group, and suddenly it died in itself. Only few are actually working on it up until today. And this is something that we need to talk about. We are not just about nursing leaders to show that we are nursing leaders, but we need to use our presence and our influence to, proceed with our objectives. Thank you so much.
All right. Thank you very much, Sir Byron. Mr. Francis, Fernando.
Hi, thank you. Thank you, Precious. So for me, I'll echo what Dr. Tuazon has already said. So in the UK, there are around 50,000 nurse vacancies. And with the Brexit, which happened recently before the pandemic, so Brexit is Britain exiting from the European Union. We are not recruiting anymore from our European Union colleagues. Or shall I say, the European nurses are coming back to their own countries from the UK because of Brexit. So the largest foreign nurses now for the last 6-7 years are the Filipinos in the UK, both in the NHS, the private and the care sector. And the reason being, apart from Brexit, is that India has limited its deployment of the nurses because of the shortages themselves in their own country. So there's only a region in India that you can recruit Indian nurses, and that's in the Kerala state of India. So they are 2.9 million. They have 2.9 million nurse shortages in India alone, so they cannot recruit in India. So recently, the governments of the Philippines and the UK signed a memorandum of understanding. We were present during that event, historic event. So it was shown at around 2 a.m. here, UK time. So some of my colleagues stayed up as well to witness that signing between the two governments. So the UK government is not only recruiting nurses from the Philippines, we will be and have started actually recruiting other healthcare professionals. So we are recruiting physiotherapists, occupational therapists, dietitians, radiographers quite recently, and even pharmacists. So what I'm saying is migration has benefits not only for the families of those professionals, but also for the Philippines. As you know, the Philippines mostly rely on the remittances of foreign workers. And in the UK alone, as I said earlier, there are more than 40,000 Filipino nurses, but the total population of Filipinos in the UK is approximately around 300,000 or even more, because every month there are Filipino nurses coming to work for the NHS. Someone mentioned about the nurses' roles, that they are not in parity with the medical practitioners or medical colleagues. So here in the UK, it's a quite different system or model. So a bit like the US model, the nurses are autonomous practitioners. They can make their own professional judgment and decisions without consulting with their medical colleagues. So they are at parity with our medical colleagues. And quite recently, I supported more than 200 Filipino nurses who were stranded in the Philippines on the second wave of the pandemic. So during that time, I think there was this 5,000 nurse deployment quota. Sorry, thank you. Deployment quota that the government in the Philippines initiated, and the UK, unfortunately for us, was excluded, and I think that's because of the upcoming memorandum of understanding. But those 200 Filipino nurses, mostly newly arrived Filipino nurses here who just visited their families for the first time after arriving in the UK, were stranded. So I liaised with the Philippine Embassy in London together with the POEA in Manila and the UK government to ensure that they are repatriated, so that they can continue to work in the UK. So that's one of the roles that the Filipino Nurses Association UK has actually led. And just very quickly, sorry, I'm just looking at my notes here. So as I said, Philippines have overtaken India as the largest foreign nurses in the UK in the last 7 years because of the reason I mentioned previously. And with the migration too, I raised my family here. So I've got 3 children. One was born here. And luckily for my 2 children, they are now they will be in the healthcare professions too. One is training to be a doctor here in the UK and one training to be a psychologist. So again, that is another benefit of nurse migration. So I think we have to also balance the rights of the nurses versus what the long-term benefits for them and their families and the Philippines as a whole. But they have to be, the Philippine government, whoever wins the election, needs to really think about the benefits for Filipino nurses in the Philippines to ensure that we don't need to migrate to other countries to have a better life for our families too.
Well said. Thank you.
All right, thank you very much, Sir Francis. We also have an input here from Mr. Floro. He said, Philippines need a panel of experts panel of experts to scrutinize the nursing curriculum that can be comparable to the EU Directive 55, which is the backbone of nursing curriculum in the European Union. Fair and equal treatment of nurses is also essential to improve the working condition of our colleagues. In the Nordic region, there is no such thing as seniority. Seniority culture gives fear among new nurses, I think. That's his contribution for the discussion, Dr. Tuazon.
That's good. If I may, I just want to share 30 seconds. I changed my screen because I really love the screen, the background. If you can read my background, I want to ask Byron to keep the spirit and Maristela, just keep fighting. But the message that I have is the proverb that I use in my personal and professional career is actually an African proverb. It says, if you want to go fast, go alone. But if you want to go far, go together. So when you have somebody else with you to help you, encourage you, support you, I think we'll be there. I used to teach before I left the Philippines, and I said to myself, I'd never leave the Philippines. I love the Philippines. I enjoyed my stay at Angeles University. I started there, and then 5 years, 6 years passed, never even thought about taking the CGFNS. The only time that it even dawned on me that I would is whenever my students would visit and say, what are you still doing here? And I asked that of Noriel 2 days ago. I said, Noriel, are you planning to go to the United States? And he says, no, I have not given up on the Philippines. So we need more Noriels. And we need more Maristela to fight for our country.
All right, thank you very much, Dr. Tuazon. Due to the interest of time, we will just be entertaining other questions via email. It has been a very productive discussion and presentation. Now we move on to the awarding or presentation of the certificates. We shall honor our esteemed resource speakers and panelists. Allow me to read the citation for Dr. Nelson Tuazon. HAUS NAM's FIND Network SORN presents the Certificate of Appreciation to Dr. Nelson D. Tuazon as the plenary speaker on the Filipino Nursing Diaspora Day 2022 webinar, Investing in Nursing, Building a Resilient Nursing Workforce, on May 7, 2022 via Zoom webinar platform. Signed, Dr. Aldi Biag, the Dean of HAUS NAMS, Dr. Violeta Lopez, President and CEO of FIND, and Mr. Erickson Bernardo, the President of SORN. Certificate of Appreciation, on the other hand, is presented to our panelists. Mr. Byron Francis Opinion. Same is awarded to Mr. Francis Fernando, Mr. Floro Cubelo, and Ms. Maristela Abenojar. Thank you very much for gracing the Filipino Nursing Diaspora Day 2022. So in closing, we shall hear from the President of the Philippine Society of SRH Nurses, Mr. Erickson R. Bernardo.
The Philippine Society of SRH Nurses Incorporated recognizes that SRH nurses, as members of the nursing workforce, have also been affected by the COVID-19 pandemic in more ways than one. Most of them were pulled out from providing indispensable SRH services and even got themselves and their families infected. Although we have laws such as the Republic Act 10354, or the Responsible Parenthood and Reproductive Health Act of 2012, and Republic Act 11223, or the Universal Healthcare Act of 2019, the pandemic has showed how ill-prepared our country's health systems are. Other non-COVID related health services were neglected due to a shift in focus to the pandemic. Majority of our health human resources were shifted to do COVID-related activities such as contact tracing, vaccinations, leaving no manpower to do other health-related activities. There have been moratorium on reporting of non-COVID related reports in our FHSIS. The long-standing issues with contraceptive stockouts were not addressed. Budget for family health sub-program has decreased drastically from 12 million in 2021 to 9 million in 2022 based on GAA. Program managers at the national levels were shifted to COVID-related management, again, putting aside other health-related concerns. Truly, we have heard from our resource persons and panelists how investing in nursing by building a resilient nursing workforce is important. But let us not forget that nursing is not confined in the four conventional corners of a hospital. The practice of nursing is not limited to direct bedside care. As the International Council of Nurses, in a position paper on the role of nurses in women's health, states that ICN believes that nurses, as knowledgeable, skilled health providers, the majority of whom are women, and are advocates and healthcare providers of choice for women. National nurses associations and nurses can and should contribute to health policy, service planning, practice development, and research in women's health. As we close today's activity, I call on our nursing leaders to continue finding opportunities for Filipino nurses, both locally and internationally. I call on the academe to continually develop highly competent nurses who will be at the forefront of society's challenges. Lastly, I call on every individual nurse, my colleagues in the profession of caring, to look back at why we took nursing in the first place. Let us always remember what keeps us in giving ourselves to the profession and continue to invest ourselves in nursing through continuous learning and development. The Society would like to thank the Filipino Nursing Diaspora Network, Holy Angel University School of Nursing and Allied Medical Sciences for the opportunity to highlight our common call to invest in nursing, building a resilient nursing workforce. Magandang umaga po sa ating lahat.
Thank you very much, Mr. Erickson R. Bernardo, the president of the Philippine Society of SRH Nurses. We also thank all of you, our dear colleagues in the various sectors of nursing work, for sharing your valuable time with us today. We would also appreciate if you send us your comments and suggestions through the evaluation link in our chat box or in the QR code flashed on the screen. We thank you once again. This is precious. It has been a pleasure virtually meeting all of you. And as we always say here at Holy Angel University, Laos Deo Semper, praise God always. Again, good afternoon, good evening for some.
Great job, Dr. Marquez.
Thank you, Paul.
Well, I hope you have a good sleep, Jerome and Byron.
Yes, so maraming salamat, Dr. Nelson.
Francis.
Thank you very much. Thank you. See you later. Thank you. Bye-bye.
Ariel, thank you.
Yes, hello po. I'd like to request everyone else the panelists at least, to stay for a quick photo op. And then as I keep on resharing the link for, let me just pause the recording.